Psychological Professional Practice Framework for Preventing and Addressing Sexual Abuse and Misconduct in Alberta. The regulatory framework for psychologists is established on the Health Professions Act and the College of Alberta Psychologists Standards of Practice. The professional framework is established on the 4 ethical principles found in the Canadian Code of Ethics for Psychologists. There are additional resources, such as the College of Alberta Psychologists Practice Guidelines. Documents informing psychologists' practice located on the college website include legislation, including the HPA, practice guidelines, a patient alert, and the CAP Monitor quarterly publication. Resources change to remain aligned with current legislation. It is the responsibility of psychologists to 1. Stay informed of all regulatory documents and legislation. 2. Align their professional practice behaviors with CAP resources for the protection and benefit of clients and the public. The HPA, an Act to Prevent Patients Amendments, is an example of a recent legislative change that resulted in a variety of regulatory resources for psychologists, including enhanced standards of practice, the development of a new practice guideline, implementation of a patient practice alert, and articles in the CAP Monitor. The existing framework for psychologists already emphasize strong ethical prohibitions to sexual intimacy with clients or former clients. CAP is in alignment with all legislative changes intended to prevent sexual abuse and misconduct. Acknowledging the inherent power imbalance arising due to the nature of the professional relationship is essential to preventing and addressing sexual boundaries. Societal demand for sensitivity, respect, and accountability related to sexual boundaries and misuse of power is increasing. Zero tolerance for sexual abuse and misconduct extends beyond health professionals and is also now established in mainstream society. Establishing and maintaining professional boundaries prevents boundary violations and ensures the professional relationship remains focused on client needs and goals. Boundary crossings and violations arise from a psychologist departing from usual norms of accepted psychological services. Informed consent establishes and maintains professional boundaries. Remember that informed consent and boundary maintenance are dynamic and ongoing processes. Let's review. The profession of psychology is informed by government legislation, standards of practice, a code of ethics, practice guidelines, and other regulatory documents. Together, these resources contribute to the regulatory framework for psychologists to establish and maintain professional relationships. Finally, they explicitly contribute to establishing and maintaining boundaries and preventing and addressing sexual abuse and misconduct.